this occasion, I would like to teach you about the surgical knots, the American technique with 2 hands and the French technique with 1 hand. So now we are gonna see a short demonstration of both techniques, and later we are going to explain more detail about both techniques. The American technique, in this technique, the string is held by 3 fingers, the medium, the index, and the pinky. The palm should be down. It's a more secure knot that support more tension. We are going to divide the surgical field in 4 quadrants, and depending where is the needle, we should decide which hand and which finger we are going to use to proceed with the knot. For example, if we are going to start with the superior right quadrant, we know that we have to use the right hand. The movement of the hand is clockwise, and we use the index. And for each quadrant is different, it's in the picture. Okay, first we are going to start with the American technique. This is our string, and this loop represents the needle. So first we are going to imagine we are passing through the tissue like this. So this is the needle, and the needle falls in the right superior quadrant. So we are going to use to hold the string with 3 fingers, and we have these 2 fingers to do the knot. So the movement of the hand is clockwise, and we use the index. Now we are going to switch our fingers, so now the thumb is trapped, and we proceed with the knot. We pull in the other way, and now our needle falls in the inferior quadrant. So we are going to use now our thumb of the right hand, and the movement is this way. So the thumb is trapped, and we are going to switch for the index, and then we proceed with the knot, and we have the square knot. That is in the case that our needle falls in the right side. But if our needle falls in the left side, let's say for instance is in the superior quadrant, we are going to use, again we hold the string with 3 fingers, and we are going to use our index, and the movement is this way. We trap the index, then we switch, so now the thumb is trapped. We proceed with the knot, and we pull in this way. Now our needle is in the inferior quadrant, and we are gonna use our thumb. So we trap our thumb, we switch the finger, and then we proceed with the knot, and then we have the square knot. When we are talking about the French technique, we need to know that the string is held by 2 fingers, and the thumb and the index, the palm is up, and this knot is faster than the American technique. Again, we divide the surgical field in 4 quadrants, and here you can see detail that which hand you have to use depending of the quadrant. and it's important to note that the string should touch the pinky if it's in the inferior quadrant, or should touch the middle finger if it's in the superior quadrant. So now we are gonna see how the French technique is the same, but in this case our guide is not going to be the needle, it's going to be the area that is without the needle. So in this case, this is falling in the inferior left quadrant, so we are going to use our left hand, and we hold the string with these two fingers, is palm up, and if it's in the inferior quadrant, the string is going to touch the pinky, and then we proceed with the knot in this way. So after we pull, the string is falling in the superior quadrant. Again, if it's in the superior quadrant, the string needs to touch the medium finger, and we proceed in this way. That is in the case that our guide is on the left side. If it's on the right, we are going to use our right hand. Again, if it's in the inferior quadrant, the string needs to touch the pinky. We proceed with the knot in this way. Now the guide is on the superior. The string needs to touch the index, and we proceed this way. As you can see, it's a little bit more difficult to catch this area. It's important to keep this very separate, this finger from the middle, so we have some space between, so we can catch this area. But beside that, we need to do this kind of movement, like a circle, so we can catch this area. The first knot is much easier because we don't need too much movements of the hand, but the second we have to do this.